Hello everyone, and welcome to today's presentation. I'm excited to have you here as we explore an important health topic. The title of our session is Understanding Diabetes, a comprehensive overview. We'll be taking a close look at what diabetes is, its different types, symptoms, causes, how to manage it, and ways to prevent it. So let's dive in and learn more about this widespread condition together. Diabetes is a chronic health condition, which means it's a long-term issue that requires ongoing management. It's characterized by the body's inability to properly process glucose, a type of sugar that's really important because it's our main source of energy. When the body can't handle glucose effectively, it can lead to a variety of health problems. Understanding diabetes is crucial because it affects so many aspects of health and well-being. If we don't manage it well, it can lead to serious complications like heart disease, kidney issues, or nerve damage. That's why effective management strategies are so important. They help prevent these complications and help people maintain a good quality of life. As we go through this presentation, keep in mind that understanding the nature of diabetes is the first step toward better prevention and management. It's a key part of improving health outcomes for those affected. Diabetes is a chronic metabolic disorder, meaning it's a long-lasting condition that affects how your body processes energy. Essentially, it occurs when your body can't regulate blood sugar levels effectively. Now, this can happen in a couple of ways. Sometimes, the pancreas doesn't produce enough insulin, which is the hormone responsible for helping sugar enter your cells. Other times, your body's cells become less responsive to insulin, so even if insulin is there, it doesn't work as well as it should. As a result, blood glucose levels start to rise over time, which can lead to serious health complications if not managed properly. Understanding what diabetes is helps us see why managing blood sugar is so crucial and how it ties into overall health. Throughout this presentation, we'll explore how it impacts individuals and what can be done to prevent or control it. Type 1 diabetes is an autoimmune disorder, which means that the body's immune system mistakenly targets its own cells. In this case, it attacks and destroys the insulin-producing beta cells in the pancreas. Because of this destruction, the pancreas produces very little or no insulin at all. Insulin is essential for helping our bodies use glucose for energy, so without it, blood sugar levels can become dangerously high. This condition is something people live with for their entire lives, so those affected need to take insulin therapy daily to survive. It's interesting to note that type 1 diabetes often shows up in childhood or early adulthood, which is why it was previously called juvenile diabetes. Recognizing these key features helps us understand how different type 1 is from other forms of diabetes and highlights the importance of proper management. Connecting this to our overall discussion, understanding the causes and effects of type 1 diabetes is crucial for developing effective treatments and supporting those living with the condition. Now, let's talk about type 2 diabetes, which is actually the most common form of diabetes we see today. It's characterized mainly by insulin resistance or sometimes not enough insulin being produced by the body. Typically, this condition develops in adults, but what's really concerning is that we're seeing more and more children and adolescents being diagnosed with it. The main culprits behind the onset of type 2 diabetes are lifestyle factors, such as poor diet, lack of physical activity, and obesity. These factors significantly contribute to the development of the condition and highlight the importance of healthy habits in prevention. Understanding these key points helps us see how lifestyle choices directly impact our risk, tying into the overall theme of managing and preventing diabetes through lifestyle modifications. Gestational diabetes is a condition that occurs during pregnancy when the body isn't able to produce enough insulin to handle the increased demands. It's important to understand that while it usually goes away after the baby is born, women who have experienced it are at a higher risk of developing type 2 diabetes later in life. That's why monitoring and managing blood sugar levels during pregnancy are so crucial, not just for the health of the mother, but also for the healthy development of the baby. It really highlights the importance of proactive care and early intervention in maintaining overall health. Let's take a moment to look at some common symptoms of diabetes. You might notice increased thirst, which is your body's way of signaling that you're losing fluids more rapidly than usual. Along with that, frequent urination often occurs because your kidneys are working overtime to remove excess sugar from your blood. Extreme fatigue is another key sign. When your body isn't processing glucose properly, your energy levels can plummet, leaving you feeling drained even after rest. Blurred vision can also happen, as high blood sugar levels affect the fluid in your eyes, impairing your ability to see clearly. You might also notice slow-healing sores or cuts, which is a sign that your body's healing process is compromised. Recognizing these symptoms early is crucial because they can help us identify diabetes in its initial stages, allowing for better management and prevention of complications. Remember, these signs are interconnected and point toward the importance of monitoring your health closely. When we look at genetics, we see that a family history of diabetes can really increase a person's risk. This is because genetic factors play a crucial role in how the disease develops. If your parents or siblings have diabetes, you're more likely to develop it too, simply because of inherited traits. It's important to understand that while lifestyle factors are significant, genetics can predispose individuals to the condition. Recognizing this connection helps us see why some people are more vulnerable, and it highlights the importance of early screening and preventive measures, especially for those with a family history. So, in essence, genetics form a key piece of the puzzle in understanding diabetes risk. Obesity is actually one of the main risk factors we see for developing type 2 diabetes. When someone has excess body fat, especially around the abdomen, it can cause a lot of problems. One of the key issues is insulin resistance, which happens when the body's cells stop responding properly to insulin. This means that even though insulin is present, the cells aren't taking in glucose as they should. As a result, blood sugar levels start to rise, which over time can lead to diabetes. So, understanding the role of obesity helps us see how important maintaining a healthy weight is in preventing this condition. It's a crucial piece of the overall picture of managing and reducing the risk of type 2 diabetes. A sedentary lifestyle, which means not getting enough physical activity, can really contribute to weight gain. When we sit around too much, it becomes harder to maintain a healthy weight, and that can increase the risk of developing diabetes later on. That's why regular exercise is so important. It helps us keep our weight in check and improves how our body uses insulin. Essentially, staying active is a key part of preventing diabetes, aligning perfectly with our overall message about the importance of healthy habits. Now, let's talk about the fasting blood sugar test. This test measures your blood sugar levels after you've fasted overnight, usually for about 8 to 12 hours. It gives us a snapshot of how well your body is managing glucose at that specific moment. This is important because it helps us understand your immediate glucose control, which is a key indicator in diagnosing diabetes. Understanding these diagnostic tests is crucial because they form the basis for identifying whether someone has diabetes or not. The fasting blood sugar test is one of the most common and straightforward ways to assess this. When we combine this information with other tests, it helps us make a clear diagnosis. So, in essence, the fasting blood sugar test is an essential tool that helps us quickly and accurately gauge blood sugar levels after an overnight fast, providing valuable insight into your overall glucose management and potential diabetes risk. This test measures blood sugar levels at specific intervals both before and after consuming a glucose-rich drink. The main goal here is to evaluate how the body responds to sugar intake. Essentially, we're looking at how efficiently your body processes glucose, which can tell us a lot about your metabolic health. This is called the oral glucose tolerance test, or OGTT for short. It's a common and important diagnostic tool to identify issues like insulin resistance or diabetes. By monitoring your blood sugar levels over time, we gain valuable insights into your body's ability to handle sugar, which ties into the overall theme of metabolic health and disease prevention. The A1C test is a really important tool for managing diabetes. It gives us an average of your blood sugar levels over the past 2 to 3 months. This helps us understand how well your glucose has been controlled long-term. Unlike daily blood sugar tests, which show a snapshot, the A1C provides a bigger picture of your overall control. By keeping an eye on this number, we can make better decisions about your treatment plan to keep your blood sugar within a healthy range. So, it's a key part of managing your condition effectively and preventing complications down the line. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's talk about the increased risk of heart disease among individuals with diabetes. As many of you know, diabetes can cause damage not only to blood sugar levels, but also to the blood vessels and nerves throughout the body. This damage makes it more likely for these blood vessels to become narrowed or blocked over time. When that happens, the heart has to work harder to pump blood, which increases the risk of serious problems. In particular, this damage can lead to heart attacks and strokes, which are among the most severe complications associated with diabetes. It's important to understand that managing blood sugar isn't just about preventing diabetes symptoms. It's also crucial for protecting the heart and blood vessels. This point really ties into our overall theme of prevention and early intervention. By controlling blood sugar levels and adopting a heart-healthy lifestyle, we can significantly reduce the risk of these dangerous complications down the line. Let's talk about kidney damage, which is often called diabetic nephropathy. This condition happens when consistently high blood sugar levels start to harm the kidney's filtering system. Think of it like the filters getting clogged or damaged over time. If this damage continues unchecked, it can lead to kidney failure. When that happens, patients might need dialysis or even a transplant to take over the kidney's function. This is a serious complication, but understanding how high blood sugar impacts the kidneys underscores the importance of managing blood glucose levels effectively. Ultimately, controlling blood sugar isn't just about preventing immediate symptoms. It's about protecting vital organs like the kidneys for the future. Today, I want to talk about how diabetes can affect the nerves in our body, a condition known as neuropathy. When blood sugar levels are not well controlled, they can damage the nerves, especially in the extremities like the hands and feet. This nerve damage can lead to symptoms such as pain, tingling, and numbness, which can really affect daily life. It's important to understand that neuropathy isn't just uncomfortable. It can significantly impact a person's overall quality of life. Recognizing these symptoms early is key to managing and preventing further nerve damage as part of our broader approach to diabetes care. Now, let's focus on establishing a comprehensive approach to managing diabetes effectively. When we talk about management and treatment, it's important to understand that there's no one-size-fits-all solution. Each person's needs are unique, and a successful plan combines various strategies. This includes lifestyle changes such as healthy eating, regular physical activity, and weight management. Medications are often necessary, and they need to be carefully tailored to each individual. Monitoring blood sugar levels regularly helps us make informed decisions and adjust treatment as needed. The key is to work closely with healthcare providers to develop a personalized plan that addresses all aspects of health. Remember, effective management isn't just about controlling blood sugar. It's about improving overall quality of life and reducing the risk of complications. So, a comprehensive approach is essential for long-term success in managing diabetes. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about lifestyle changes for diabetes. Making adjustments to your daily habits is crucial in managing this condition effectively. First, focusing on a balanced diet plays a vital role. This means eating more whole foods, vegetables, lean proteins, and whole grains, while cutting back on processed foods and sugary snacks. Next, regular physical activity is key. Even simple activities like walking or cycling can help improve insulin sensitivity and keep blood sugar levels in check. It's about finding activities you enjoy so it becomes a sustainable part of your routine. Weight management is another important aspect. Losing excess weight can significantly improve blood sugar control and reduce the risk of complications. Sleep is often overlooked, but is equally important. Getting enough quality rest helps regulate blood sugar and supports overall health. Finally, managing stress through techniques like mindfulness or meditation can have a positive impact. Stress hormones can raise blood sugar, so finding ways to stay calm and relaxed is beneficial. Remember, these lifestyle changes are not just about managing diabetes. They also enhance your overall well-being and quality of life. Incorporating these habits into your daily routine can make a real difference in your health journey. Effective management of diabetes really hinges on having a thorough understanding of the condition. It's important to be familiar with its different types, recognize the common symptoms, understand what causes it, and be aware of the potential complications that can arise. When you have this knowledge, it becomes much easier to take control of your health. Adopting a balanced lifestyle is key. This means making healthy eating choices, staying active with regular exercise, and monitoring your blood sugar levels consistently. These steps are crucial because they can help improve your overall health outcomes. Most importantly, they can also help prevent serious complications down the line. Remember, managing diabetes isn't just about medication. It's about making everyday choices that support your well-being. By staying informed and committed to these healthy habits, you can live a healthier, more balanced life despite having diabetes.